Well, first of all, we have to be so careful about generalizing. You know, you know, even though I say that, as I sit here, I've written books on relapse prevention for African Americans, and I wrote a workbook on relapse prevention for African Americans. But there is no one type of African American client, because, you know, the reason I think Ebonics would have never worked, because there's no one way that African Americans speak. So if you had Oakland Ebonics, you needed New Orleans Ebonics and Brooklyn Ebonics and Houston Ebonics. So when we talk about African American clients, I think one of the first things to be careful about is generalizing and categorizing African Americans as one group, and any one approach is going to work with all of these clients. An African American with a personality like President Obama versus an African American with a personality like Ludacris or 50 Cent. You know, there's totally different issues, and so, but as a generalization, having said that, typically in a treatment setting, many African American clients access treatment via the criminal justice system. That's an important piece, and so I think that one of the things that I believe is important for providers is to recognize that piece, that many of them have some connection to the criminal justice system. They may not all be addicts or alcoholics just because they've been caught up in the criminal justice system or have been arrested for drugs or alcohol. So keep that in mind. Having a program staff that's culturally sensitive. Remember what prompted me to write a book about African Americans in addiction treatment was watching my staff or other staff, not non-African American staff, not know how to react to African American clients having a full range of emotions. So we had an African American client would get angry, white female staff member would feel intimidated, would feel scared, would feel unsafe. Did the fact that she felt unsafe mean that the client was threatening? Was it about her or was it about him? His anger made her nervous. Does he have a right to be angry in a treatment program? I think all programs should have cultural, and I know it probably feels overdone, but I think all programs should have cultural sensitivity training, that the staff members can openly and honestly explore their own prejudices and biases, and that could have some techniques in place to work through those things so that they don't interfere with the treatment process. Those are some things that come to mind from the top of my head. To open your mind and to not believe that one size fits all. To know that there are many paths to recovery. I want them to walk away with some practical skills. I want them to walk away with some technique, not just a bunch of philosophy or theory or my perspective, but I want them to walk away with some techniques that they can use tomorrow when they're back there with their clients. I want them to walk away with the knowledge that you don't have to be one to help one, that it's not the messenger, it's the message, and that anybody in that room is capable of saying something that can save somebody's life. And I also want them to understand the responsibility that goes with that we have a responsibility as these people are fighting for their lives. Most people will try to get clean, fail. The reality is most of them fail. We want to do everything that we can to increase their slim odds of recovery. So we need to be part of the solution. We have a responsibility as caregivers to do everything we can to increase their slim odds. We want to be knowledgeable, we want to be compassionate, we want to be supportive, and we want to be clear about what we bring to the table. So if I'm not okay, I need to have something in place where I can take care of myself so that what I bring to the table is healthy. So I want them to leave with that.